In this video, I'm going to show you how to do the best exercise for getting rid of your elbow pain. It doesn't matter if you have tennis elbow or lateral epicondylitis, golfer's elbow, or medial epicondylitis, doesn't matter, or just if your elbow hurts. This exercise is amazing. It works for the majority of people I treat who have elbow pain, regardless of where that pain is. If it's elbow pain really coming from your elbow, not your neck, this exercise is probably going to work for you. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and in this video I'm going to show you how to do elbow extension in a loaded position. If I were stuck on a desert island, I would bring this exercise with me. This is video number 2 in a series I'm doing showing you how to treat your elbow pain. In the first video, I showed you how to do repeated elbow extension. Now, if you've been doing that exercise and it's eliminated your pain, then don't do this one, just stick with that one. In fact, if it eliminated your pain, I guess you wouldn't be watching this video. But if you did that exercise and it helped, but not all the way, and you're doing enough repetitions, meaning you're doing 10 to 15 reps 5 times a day, and it's still not getting rid of your pain, then I would suggest you go to this one. If you did that exercise and it made you worse, don't do this one. Go to my video, repeated elbow flexion, loaded elbow extension. To start off, you're going to have your hand in a loaded position. So by loaded, I just mean your hands will be on the surface of the table. So if you remember the previous video, repeated elbow extension, it was unloaded because you were just extending your elbow. Okay? It wasn't on the surface of anything. So now you're going to need a desk or a table, and you're going to place your hand, fingers pointing toward your stomach, palm down on the table this way. And I'm not leaning into it. All right? My hand's just resting there. And then from there, extend and off. Extend and off. So when you put your hand on the table, the palm's going to be down. Our fingers are going to be pointed toward our stomachs, actually. And notice my fingertips are not on the table, because that just puts a lot of stretch here. They're going to be actually hanging off the edge of the table. Here I am. Extend, just like that. Extend the elbow and back off a bit. You don't have to bend it much. Just back out of the stretch. Just back out of the mobilization. So pressure on, pressure off, pressure on, pressure off. Each time trying to go farther and farther. So as I said, in most cases you need a little overpressure. Most people do, because we want to get to end range, and typically end range is where the magic happens. And you're usually not going to get to end range unless you add a little overpressure. So to do that, I'm taking the web space here. I could do just my palm or my fingertips. It doesn't take a lot of pressure because this is not a huge joint. And when you're doing the overpressure, make sure that you're below the point of the elbow. That will just give you a little more leverage when you're doing this technique. Palms on the table. I'm just lightly resting it there. My palm is below the point of the elbow. I extend, overpressure. Extend, overpressure. Extend, overpressure. Holding for maybe 1 or 2 seconds. Overpressure. This feels really good to me. This is a technique that works well for me, actually. Extend the elbow, overpressure. Just driving it straight ahead that way. Extend the elbow, little push, just to get you farther. That's it. Each time I'm maybe holding 1 or 2 seconds, and then off. Pressure on, pressure off. Each time, trying to go a little farther. When you get done, shake it off. Try those things out that were painful. Opening a door, picking up your coffee mug, whatever. If those were painful, try them out, and it should feel better. If not, do another set or 2 and then try it again. If it feels worse, stop. Don't do this exercise. Go and do my video for elbow flexion. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and I've just shown you how to do repeated elbow extension in a loaded position with your hand on a table. The dosing for this exercise is 10 to 15 repetitions every 3 to 4 hours, so try to get 50 or 60 repetitions in a day. Do that for several days, and as your pain gets less and less and fully goes away, then you do the exercise fewer and fewer times a day, until you get to the point where you might only be doing it once a day as a preventative measure. If you like what you've seen in this video, subscribe to our YouTube channel and click on the little bell. That way you'll be notified every time we upload a new video showing you how to do one of these powerful exercises for eliminating pain. Like the video and share the video with your friends and leave comments below. Let us know if you tried the exercise out and if it worked for you. If it worked, great. Let us know. We love to hear that. And if it didn't work, let us know that as well, because then I can suggest a modification to the exercise which might make it more beneficial to you, or I can steer you toward another exercise altogether which might be more appropriate for you.